Our study set out to interview LGBTQ plus people who'd used alcohol services in Scotland. And we also talked to people who worked in alcohol services because we wanted to get their perspective too. And what we found was that LGBTQ people who'd used alcohol services did perceive that their heavy drinking was linked to the LGBTQ plus identity, whether it was linked to rejection from their family, whether it was linked to hiding their identity. And we saw from our results as well how ubiquitous alcohol was. So some people talked about alcohol being a mask so that they could fit in when they didn't want to reveal their identity, whereas others talked about using alcohol to be themselves and to go out and to show their identity. However, when people got to alcohol services, they often found that alcohol services didn't ask them about their identity or didn't think it was relevant. And this was something that was quite difficult for people. When we talked to people working in alcohol services, what they said was that they were quite concerned about asking people about their identity, being perceived to be nosy, being perceived to be inappropriate, and they felt if it was important, LGBTQ plus people would raise it themselves. So we're kind of stuck in this situation where nobody really knows how to raise it appropriately and whether they can talk about it.
At a deeper level, to make sure that you are actually an inclusive service, so you've not just marketed and sold as a pup. If we come into the service and then encounter nothing like what you're saying outwardly, would be things like staff training. Is the number one most important thing you can do, is to make sure that staff are aware of our life experiences and aware about the issues that affect us that are particular, and aware of the health inequalities that affect the LGBTQI community. I would say that's the most important thing an organisation can do. There is one of our partner members, that LGBT Youth Scotland, runs something called the LGBT Charter Mark. I would highly recommend that any substance use service takes that or something similar.
We're not talking 3 years at university to learn how to use the right language around trans people. We're talking about an hour awareness training that will give you the tools you need to just talk, and then over the course of time you will get better at it because you've spoken to more people. So we have this ridiculous situation at the moment where trans and LGBT people are afraid of approaching services because services don't look like they know how to treat trans and LGBT people, and we have services saying, we would love to treat LGBT and trans people, but we don't know how to talk to them, and we don't know. So we need to meet in the middle.